think we're ready to get started. Let me just see here. So good morning, folks, and thanks for joining us this morning. Just want to start by saying, Happy New Year to everyone, and I hope that the year has been relatively, good for everyone, notwithstanding the continuing challenges we face. I also want to say thank you for continuing to support the campus community and our mission and doing whatever you do every day to ensure that we continue to do what is expected of us and what we expect of one another, even as we navigate the continuing challenge of the pandemic. So what we're trying to do today is, as we've done in the past, when there are these major transitions and our effort through this pandemic, to try to get together as a community and have a conversation that allows us to, in real time, address things that may be on people's minds in ways that other forms of communication, whilst very useful, may not lend themselves to. So we've tried to keep you posted on developments, on changes and so on, but we thought an opportunity to meet in a town hall setting would be really helpful to make sure that you're getting questions directly unfiltered to address things that are on your mind. So that's what we're going to do this morning. My colleagues are going to spend some time to provide some information, some context, and we want to use the bulk of our time, having a conversation with each, with each thought on your minds, and making sure that we are not left with gaps in understanding and information. So the way we have it structured is Andrew will start off, and then we'll go to Bill, Desma, Desmond, Irina, and then we'll open it up for a Q&A. And we are using the Q&A, option. So you can post your questions, we'll respond to them, either behind the scenes, or I'll have folks address them directly in the conversation. So with that, I'll turn it over to Andrew to get us started. Please go ahead, Andrew.
Thank you very much, Wisdom. Just as a bit of an update in terms of some changes. So today marks day 683 of our pandemic response. And we've had teams of people that have been working really hard. And so I just wanted to start by thanking everybody for all your efforts, the flexibility and adaptivity that people have shown over the last number of months has been really remarkable, in the efforts that people have gone through. So just thank you to the teams of people that have been working on this. We are preparing for return to work. Our plan was to come back originally on January 31st. We are now shifting that date, and there's a phased in approach that we'll be taking that Professor Goff will speak to. But really what we're doing is we're asking people to refresh some of the work that they've already done. A lot of the thinking has been complete, and it's just now being shifted from the 31st to a slightly later start date. There are a number of questions that have come up, one around masks. So the university is now recommending people use ASTM medical mask levels 2 and 3. We are working to make sure that those masks are available. So masks will be available in the U of T bookstore, but they can also be purchased just about anywhere where masks are sold. And just look for the ASTM level 2 and 3. In addition to that, we will have some masks available on the campus. We are looking at various distribution settings. One of the approaches is to have some masks available in each of the classroom spaces. There are mask dispensers that are coming in where we will have a location where people can come pick up masks. And we're also looking to see if we can get them bundled for free distribution in the vending machines across the campus, as well as some key pickup points, such as the library. So we're working through that right now, and we're continuing to follow provincial guidelines. In the event that there are some very high risk roles, such as some of the facilities cleaning or campus police, they will be mask fit tested for N95s, or have already been mask fit tested for N95s. People may choose to wear N95s. It's not required. The government has not asked us to take that on. So we ask people, we will make ASTM levels 2 and 3 masks available on campus, and people are free to pick those up. Also, with rapid testing, we have orders in with the province for rapid testing. We're hoping to get our next batch of rapid tests, but right now there's a significant distribution challenge that's out there, and rapid tests have become very difficult. We are hoping that in the next week or so that those rapid tests arrive and we can begin to come forward with the distribution process for rapid tests when they're available. There's also questions about what fully vaccinated means. We're continuing to use the provincial definition of 2 doses of vaccine, though many in our community, and that will be required to be part of our campus community, though many of our community already have a 3rd vaccine. We are looking, and UCheck, we're hoping to target UCheck for the end of, for next week, to be available for people to upload their QR code for their 3rd vaccine if they choose to do that. But we are continuing to follow provincial guidelines in terms of what's required of vaccination, and that current guideline has us as having 2 valid vaccines approved by Health Canada. So that's continuing to be our standard in terms of vaccines. We are currently also working with Scarborough Health Network and have a COVID testing center on in Highland Hall. That testing center will be converted for the course of this weekend to be a pop-up vaccine clinic. So if people do have requirements for a 3rd dose, 1st dose, or 2nd dose, the vaccine clinic at UTSC will be available, as will Centennial College is also running a vaccine clinic. And we have worked out with Scarborough Health Network that they will be able to provide us some pop-up vaccine clinics to meet demand that we may have on campus as well. So we'll continue to keep you posted. To access information on the vaccine clinic, please go to the Scarborough Health Network website and follow the link to vaccine clinic, and you'll have further details there. Again, this is their vaccine clinic that we are supporting on our campus. It's not a U of T Scarborough vaccine clinic. And we just wanted to thank all the members of the working group around Scarborough Health Network for all the terrific work that they've done. And with that, I think I will pass it on to Professor Goff.
All right, thank you, Andrew. And I echo Andrew's by thanking everyone here for your absolute superlative efforts under very trying professional and personal circumstances, especially over the past 2 years in order to fulfill our academic mission. I think we're doing that. It hasn't been ideal, but with your effort, it's made all the difference. I had hoped that this would have been a fully in-person term at UTSC. It certainly looked like that would be possible when we started planning for winter of 2020, this winter last spring. Sadly, we've experienced yet more twists and turns in our peripatetic pandemic journey that has delayed this. A number of principles are at play that determine how we are delivering our courses for the rest of the term. These include safety, the well-being, both physical and mental, of our staff, instructors, and students, the student experience, the educational pedagogical experience, which of course is related, the rights of the individual versus the collective rights of our community, and our fiscal well-being. These considerations are always present whenever we make decisions, but differences among them have become exacerbated during the pandemic, depending on which principle or principles have greater weighting in your thinking, much more so than at any other time during the pandemic. So I do understand and anticipate questions that arise from these different perspectives. The approach at UTSC is phased with some in-person elements returning on February 7th and the remainder on February 28th after reading week. Each academic department has developed a plan reflective of these 2 dates and submitted them, and it's largely reflected in what's in the calendar now. I note that some courses were planned to be fully online this term, and these will remain online, including health and family care needs of our faculty that have and these faculty members have gone through the appropriate process to move their course online. We have taken some steps to reduce the large number of large enrollment settings. We, starting last term in our planning process, we allowed classes of enrollments of over 250 to either go online for the lectures or have them web optioned if they remain in person, which we know from past experience reduces the in-class numbers and also provides flexibility for students. Before the break, we allowed all courses that were 100 plus the same option. We're also allowing courses that have in-person exams as the only in-person element to move those to fully online if they feel comfortable with the pedagogical approach to an online exams. In some instances, having an in-person final exam is considered critically important, but not in all cases. At present, we are considering pathways for our international students who have not returned to Toronto, recognizing travel to Toronto is not straightforward this time. A particular focus is on the group of remote students who are planning to graduate after this term. We hope to be able to provide an update on this, on these plans at the student town hall, which is being scheduled for Friday morning. So I'm here today with my vice deans to answer questions about the academic aspects for the rest of the term. So I'll turn this now over to Desma.
Thanks, Bill. Hello, everyone. The update from the Human Resources portfolio will focus on the alternative work arrangement process. We also refer to those as the AWAs. As per last week's all community messaging, we in HR are currently working with our leaders on campus to establish AWAs for each department that will have hybrid working arrangements. So the AWA guidelines, just as a reminder, was introduced in July of 2021. These arrangements are either employer initiated or employee requested. We are expecting that most of our AWAs at UTSC will be employer initiated, as we've already done quite a bit of work and return to work planning this past summer in preparation for the 2021 fall term. The difference this time around is staff working in a hybrid model will be expected to have a documented plan on file. So each arrangement will be time limited with a built-in review date. So we're hoping to have all arrangements in place for February 7th and beyond, and managers will be expected to share those plans with your staff as soon as possible. We recognize that the timeline is fairly robust. However, as mentioned previously, most of the departmental return plans and working arrangements from last fall will likely look fairly similar, and would just be a matter of documenting these plans with the use of the AWA templates. So there'll be some more communication coming through your departments and with respect to sort of the alternative work arrangements as we move forward. So thank you, and I will turn things over to Desmond.
Hello, everyone. Thanks, Desma. And I just wanted to start by reminding folks a bit of where we were last fall and into December, because during that time we were, of course, very hopeful about this pandemic diminishing, and we were all very much looking forward to returning in person in the beginning of January. In fact, things were so good that in Osu, we were able to have an in-person holiday gathering in the event center, and an additional in-person holiday gathering early December. So we were very hopeful. We were planning with that in mind for a return in January following the holiday break. And of course, we know what happened. Our plans were in fact ready for that return. So come February 7th, we will be actually moving forward with the plans that we had for return at the beginning of January following the break. Our plans really have been developed, as they have all along, with health and safety concerns top of mind, not only for our staff, but of course for our students. And that means we had plans to return providing both in-person and online services to students. And this is what we will be doing come February 7th and moving towards February 28th, when we anticipate that everyone will be back and that most academic offerings will, of course, be being offered in person. So our plan is to phase in through this period through to February 28th and to be back in full operations come February 28th and after. Now, one of the things that we discovered, and I'm going to raise this because this ties into something that Desma referred to around AWAs, we have discovered through the course of 2 years that many of our students have come to appreciate many of our remote offerings, and it creates for them great flexibility. And I mentioned our counseling and mental health services as an example. We have been able to offer all kinds of programming that way. So we will be looking in all of our service areas as to how to continue to offer some form of virtual or remote programming going forward. Now, obviously, this is a complicated process and will be worked out, adhering to HR requirements and with our student-centered approach. So this is something I know that our units are all contemplated and have been for some time. So that's where we're headed. But of course, we are and will continue to be obviously a university and a campus that's focused on delivering our education in person format, and that's the major delivery format going forward, with the caveat that I just mentioned. So that's where I'd like to stop. Again, I just want to assure our staff that the health and safety of all of you is paramount to what we are doing, to our plans, and they're obviously dynamic in the sense that this pandemic has shown us that we always have had surprises. So if there are future surprises and so on that have to be addressed, then there could be in the future some additional twists and turns that we are yet to imagine. So thank you very much. That's all I have.
So we'll turn it over to Irina next.
Thank you, Wisdom, and a belated Happy New Year to everybody. The tolls of COVID-19 on our campus community are clear, and even the most resilient of us are feeling the strain. For researchers, this has resulted in major disruptions in their research, including cancellations, delays, pivots, and associated frustrations. I just want you to know that we are here to support you and address any issues or concerns that you may have. As you know, we are currently in phase 2. All research that can be done remotely must be done remotely. And for research that cannot be done remotely, 2-meter social distancing and medical masks level 2 or 3 are required. And no research space should exceed 65% of normal occupancy levels. And just recently, and this is even came through 11 o'clock last night, starting February 7th, the 65% capacity limits to normal occupancy levels will be removed. However, laboratories should continue to be prepared for the possibility of staffing disruptions and shortages, including having contingency plans in place for all critical experiments and equipment maintenance. We are continuing to monitor public health directives, and assuming these directives allow it, starting February 28th, on-campus academic research spaces that meet the definition of instructional space may operate at full capacity without 2-meter distancing, as long as appropriate medical masks are worn. I do have to say that we are now still maintaining a pause on all face-to-face research involving human participants. And as soon as and only for exceptional situations will this be reconsidered. And I will promise and commit to those who do face-to-face research that as soon as we hear any changes to that, I'll be the first to let you know. I also want to remind everyone that in addition to these institutional recommendations and requirements, those conducting on-campus research must follow their department's processes because they may have additional constraints in place. And I want to say that together with the Dean's Office, my office continues to seek new ways to help support our researchers, including student and postdoctoral fellow researchers, especially in response to the challenges generated by the pandemic. And to that end, last month, we created a one-time only fund for Scarborough faculty that enabled them to apply for up to $8,000 for each Scarborough affiliated graduate student they supervise to support any aspect of the research enterprise for these students that have been negatively impacted by the pandemic. We received 136 applications, which represents 37% of all Scarborough affiliated graduate students. These applications are being reviewed and we expect funds to be available on February 7th or soon after. And finally, I just want to assure you that the university-wide Research Restart Committee, as well as the UT Scarborough Research Restart Working Group, continue to meet regularly and work diligently to ensure that the research operations at the university and at this campus can continue safely and in a comprehensive manner as is possible. Thank you, Wisdom.
Thank you, Rena. Thanks everyone for providing those updates. And so I think now we'll open it up for broader conversation. So please, if you've got a question, feel free to raise your hand and I'll call you. But you could also use the Q&A function and we'll address them in order.
I'm happy to take the question on masking inside buildings. There is a very stringent guidelines. We'll actually post them in the chat momentarily around when masks can and cannot be worn. And so we ask people to follow that policy. More broadly, though, we have to remember that many or most of our buildings have significant air changes per hour, right? So even if somebody is sitting within a room, each room itself is actually balanced through a regular process that we go through to ensure that air is actually transitioning. So that's not static air. It's not just standing there like it might be in the case of somebody's home, that these are institutional buildings and have significant air changes. So in those few cases where people aren't wearing their masks in their offices, there's significant air filtration that's actually happening as part of the base building system. And that was
Thank you, Andrew.
On to CS's question.
And we've got some additional mask, questions.
I see there's a question from Mark McKee. Are ASTM level 2 and 3 masks mandatory for faculty, staff, and students, or can we continue to wear masks that were deemed appropriate before the break? The guideline for the university community is now to shift to ASTM level 2 and 3 masks. People may choose to wear cloth masks on top of that as well, which is perfectly acceptable. But the guideline is that people should be now wearing level 2 and level 3 masks. And not only within the university, I think it's really important for people to understand that the university is a very different environment than the general public. Everybody in our community must be vaccinated to be on campus. And the risks on campus are significantly lower than what you might find if you went to, I don't know, a big box store or some other amenity. And the requirement that we're suggesting, or the suggestion that we have, is ASTM level 2 and 3 masks be worn, but people should be wearing those masks wherever they're going out in public. I will also note that guidelines are changing, that the province is loosening guidelines, that we are going to be at indoor gatherings with restaurants reopening. All of those activities are restarting again over the next couple of weeks. So by the time we get to being fully operational towards the end of February, the outside community will be much more active, and people will be dining in restaurants and so forth again. And so, the recommendation is that those ASTM level masks are being worn whenever you're going outside. It's probably best practice to wear those masks at this point.
Thanks, Andrew. Tamara, I think we've got a couple of other mask related questions.
Yes, so since we're on that topic, disposable masks are required. So will UTSC be participating and providing collection bins for mask recycling program?
At this point, we are not recycling disposable masks. There isn't the capacity for us to be able to manage that, and I don't think it's best practice to be recycling those disposable masks.
Thanks, Andrew. Tamara, next question.
Okay. University policy based on practice and or Ontario Toronto public health requirements or guidance. It says if students' U-check status is being checked by faculty or staff or a class, all students must be checked to be fair to all. Does this mean that faculty or staff in a class are the only people accountable for checking student statuses?
So again, starting on February 7th, we will have our U-check ambassadors all over the campus. Not only will they be asking people to ensure that they have completed their U-check, but they'll also be equipped with masks, so they can actually be handing out masks if people have the inappropriate mask. So the U-check status will also be checked at various pickup points and various entry points like libraries and so forth. So there will be a number of people that will be checking U-check status. And one of the things that we really ask everybody to do, including faculty and staff members in addition to students, is everybody should keep their U-check up to date whenever they're coming onto campus.
Thanks, Andrew. Now, the other thing to add is certainly not just faculty having responsibility for this, but I think you manage the classroom environment like you do in other settings, and this safety of the class is important as well. So feel free to manage those as you would any other situation in your classrooms. But certainly a key focus of this continues to be education of our community and trying to work together, for mutual health. And so we'll continue to use the ambassadors and other venues to make sure we're educating and continue to educate as part of the enforcement mechanism for the campus community. Next question, Tamara?
After the vaccine.
Before that, Bill,
sorry.
is there anything, Bill, you want to ask? You want to add about the classroom management of the mask requirement?
I was going to make the same comment that Andrew did, that student-facing groups such as the library and other student services also check the green screen. So it isn't just on faculty.
And I think Irina made the point earlier about in research spaces, the expectation that we'll be wearing masks. And so supervisors and others in charge of those spaces, we all owe it to one another to make sure we're following proper protocol. All right, Tamara, next question, please.
Okay. After the vaccine pop-up, will the event center go back to a testing center?
Yes, it will. We anticipate that Scarborough Health Network will be running that as a testing center likely through most of February, and then transitioning away from that by the end of February. But we will use it for pop-up clinic this weekend and potentially another date or two coming forward.
Thanks. Tamara, next.
Okay, can you provide us with some clarification regarding room capacity? What regulations are we to follow for office spaces versus classroom and teaching spaces?
So I think, Andrew, you can take it. I think Desma, you could also talk about this in relation to, the alternative work arrangements, because that is, there as well. And then anybody else who wants to chip in, Bill. So let's start with Andrew, Desma, and then Bill.
So we're continuing to follow the provincial guidelines in terms of how those spaces are defined. And so room capacities are the stated capacity on the outside of the rooms. The province has deemed that teaching spaces in the university setting do not need to follow 2-meter social distancing requirements. And so that's what the standard for those spaces are. For office spaces, we do still follow social distancing requirements, and which is why we have some particularly open units or shared office spaces where there's people that are actually rotating on their presence on campus to ensure that we're compliant with the social distancing guidelines where they apply.
Desma, anything to add?
I think the only additional piece to that is that with all what Andrew just said, one of the things that will help with the scheduling is around any shared spaces with staff and just that capacity within that space. So it's important to look at sort of the scheduling and staggering what days that they're in to avoid having multiple people that share a space in at the same time. So those types of AWA arrangements will help with sort of informing that process, as well as making sure that everyone is safe within the space when they are on campus.
Thanks. Bill?
Just want to reiterate that for the large enrollment sections, so classrooms that are 250 plus, these ones have either gone online or been web optioned. And we know from past experience, when we web option these spaces, the attendance in class cuts by about 50%. So those classrooms won't seem as crowded as the capacity would normally allow them to be. Also, for courses that have gone online, we have moved other courses of smaller enrollment into those spaces to maximize the number of rooms that are under capacity in terms of numbers. And outside the classroom space has been handled by the others.
Thanks, Bill. And Irina, you had mentioned the 65% capacity. You'd also talked about depending on whether those spaces could be used as instructional spaces, in which case, what Bill just talked about would be applicable in those settings as well. But anything else we're missing, Irina?
Just key that it's the definition of research laboratories as instructional spaces will only apply starting February 28th. So we are slower to go back to what we had before December, and only following public health directives will that change after February 28th.
Thank you. Tamara, next question, please.
It can be hard to tell which masks are being worn between the level 2 and level 3 ASM masks, wearing of the appropriate mask.
Okay, it was cutting out a bit for me. I don't know whether, could you please repeat?
Yeah, so it's hard to tell sometimes the difference between the level 2 and level 3 masks. How will the university enforce wearing of the appropriate mask?
Andrew, I hope you caught the gist of the
Sure.
question.
So the question is, how will the university be able to enforce if people are wearing level 2 or level 3 masks? So again, this is not the university enforcing. We are part of a community together, working together, and this is why we're making the masks available. There was some concern at some point whether there was an affordability issue or an equity issue, and to respond to that, we're making masks available wherever they are, so people are free to come in and use the best mask. Everyone in the community that's coming to the campus wants to look out for each other, and so I don't see why people would want to deceive people in terms of the mask that they're using if they're freely available. So the approach isn't enforcement, it's encouragement, it's answering questions, and making sure that masks are available for our community.
Thanks, Andrew. Next question, please.
As all visitors to campus must be fully vaccinated, are those who are coming to the testing center in Highland Hall also required to be fully vaccinated?
Andrew.
No, the testing center is actually completely isolated from the rest of the campus. So the way that we've set it up is it's a separate air handling unit. It's a separate access point. At the moment, I think we're running about 200 people a day are coming through that testing center. And that testing center will begin to reduce operations as the community comes back in full force. And so we've been running a testing center on and off in that building for about 1.5 years at this point, and we have excellent processes and procedures in place, and we don't believe it poses a risk to our community.
Thank you. Next question.
Can UTSC clubs book classroom or meeting spaces to hold meetings and events that fall within the capacity limits?
Andrew, do you want to take that, or do we?
Yeah, I think this is something that we're continuing to work through in terms of following the guidelines and gatherings. So when clubs are coming together, it actually doesn't fit within teaching, the teaching definition, which was what we use around the allocation of these spaces. It falls in under gatherings. And so right now the university isn't supporting gatherings. But again, as the provincial guidelines begin to change, that we will update those policies and make those rooms available. It's really important for us to try to get our community back to some semblance of normal. And students participating in extracurricular and co-curricular activities is critical to the student life that we have. And so we want to follow guidelines and ensure that we have appropriate spaces for students to do what makes this campus such a rich and enjoyable place to be while keeping everybody safe.
Desmond, anything you want to add to that in light of the fact that a lot of classes
Sure.
are student facing?
Sure. I mean, I think just to remind folks that pre-COVID, we had over 280 plus recognized student groups on campus. And we have now basically recognized over 200 of them again as we are at this stage of the COVID situation. And those clubs are, of course, keen to get moving with events on campus. So through our co-curricular area, we do help students to navigate booking spaces and to hold events. We have a risk management process that we have always had. So those things will be in place to help to guide student groups who want to have events. And of course, it's going to be all framed within what's permissible given whatever stage we are in with the pandemic in terms of, and I think Andrew was in fact getting at that in his comments. So that's all I would say, Wisdom.
Thank you.
Thanks.
Tamara, next.
Will we be maintaining the staggered return to campus past Feb 28th?
Desma.
With some, our schedules will be tied to sort of the AWA arrangements that you've put in place. So that is dependent on the department itself, their operations, and sort of the plans that they've put in place with their teams. So for some areas, it depends on your schedule, and that will determine the days that you will be in on campus and the frequency on campus. So I think some of that staggering may happen in areas, but for the most part, most folks will be returning as of the week of February 7th, as per the announcement last week.
Thank you. Next question, Tamara.
Okay, this one's a long one. It's been communicated that the same measures that were established to return to in-person prior to the Omicron wave are the ones that will be followed now. Are the added measures that have been implemented, given the substantial difference in levels of transmissibility of this new variant, sorry, I skipped a line, and given instructors varying levels of risk tolerance, how much leeway do faculty members have in terms of social distancing?
Bill, you want to take that one?
So we have a number of individuals that have health and family concerns about teaching in person, and these have been handled through health and well-being and family care office for exemption, taking into consideration the circumstances the people are in and the circumstances we are in as a province. So if individuals have concerns or they have elevated concerns because the Omicron one is different, they can follow this path, and we will accommodate accordingly.
Thank you, Bill. Tamara, next question, please.
Faculty are being inundated with emails from students who are concerned about their health and safety. We're at the height of the worst wave of the pandemic. Why is now a good time to return to in-person?
Okay, so I'll have Bill respond first, and then Andrew, you can put in the broader context of the discussions at the very stable. So Bill, please go first.
So I'll note that everyone that's participating in person is required to fulfill the vaccine mandate. So this is why this wave is different than, say, the peak of the wave, the third wave, or whatever number it was at last March and April, where a sizable portion of the population were not vaccinated. So this places, so we've created a safer environment by insisting that this on this vaccine mandate. We also have the experience from last fall in other divisions for example, arts and science and engineering that went more fully in person last term to draw upon. So we feel the circumstances are different. We recognize, however, and that's why we have a two-phased approach. So February 7th, a number of in-person elements, particularly those that are deemed pedagogically essential, such as laboratories or other in-person elements of a similar nature that are best done in person, are clearly the ones that are coming back sooner. And then the remainder at the end of February, in which the circumstances that we find ourselves in may be very different than they are today.
Thanks, Bill. Andrew, anything to add?
Sure. Yeah, we continue to follow guidelines from the scientific tables. We're fortunate that the University of Toronto is so connected to a lot of the discussions and the decisions that are being made across the university system. And the university system is coming together. So there are regular meetings that include the universities across Ontario, as well as the universities across Canada, where these discussions are actually being had. And what we're starting to see now is that the Omicron trend is starting to come back down. And as Dr. Goff points out, that as we get towards our full opening towards the end of February, we expect that the height of the Omicron is actually waned, and we're actually on the downward side. And we continue to work with aligning what the university is doing with provincial standards and guidelines. I know there was a question earlier around why did the university choose to implement this mandatory vaccine policy? It wasn't a choice. We were directed by the province that we had to implement a mandatory vaccine policy, just as other parts of society were mandated to do this work. So we continue to follow provincial guidelines and federal guidelines. We're taking advice when we can get it. And we're also working, we have regular standing meetings that are bi-weekly within the campus and regular meetings across the university that are constantly updating and reflecting on the policies that we're being asked to enforce, and we're trying to interpret those policies in a way that gives us the best experience for our community members based on the information that we have at a particular point in time.
Thanks, Andrew. So, as my two colleagues have said, we're not doing this in isolation. We're doing this in constant conversation with relevant, knowledgeable bodies. And it's worth noting that the Chief Medical Officer of Health has indicated that this is a prudent thing for us to do. We've also been very clear that if circumstances require us to respond differently, we're willing to do that. So a lot of the decisions have been based on the evidence, and where the evidence is pointed in different directions, we haven't hesitated to make decisions. So just want to assure people that the primacy of the health and well-being of our community is not going to be compromised, and we'll continue to make sure that that is the fundamental determinant of where we go. But certainly the work is being done with relevant information, with appropriate parties involved, and so just want folks to know that these are really well thought through things, making sure that we don't compromise the health and safety of our community.
May I just add?
Desmond, yes.
Yeah, I think there are also important other considerations as well. And I just want to remind folks about the tremendous mental health toll that this pandemic is taking on people. And, 3 in 1 Canadians are really reporting issues with mental health and related to this pandemic, a lot of it. So I think you know, there are many concerns that are balanced, and you know, you've heard from my colleagues about certainly the health and safety concerns directly related to the pandemic and worry about transmission of the virus. But let's remember there are huge other concerns, and mental health is a big one. And this is impacting everyone, staff, faculty, everybody is impacting, including our students. So it's balancing all of these kinds of issues, many of them very, very difficult. And so at the end of the day, the solutions that are taken are not going to please everyone. But I think the path is clear. We're on safety. We're on the path of health and safety with respect to the virus and its transmission and all of the issues there, but also the safety from other perspectives, I think, are really important. Mental health top of line for many, many, many people. So that's what I wanted to just convey, Wisdom. Thank you.
Thanks, Desmond. Tamara, next question, please.
So it just says, are there any added measures to the previously established that have been implemented given the substantial difference in the levels of transmission of the new variant? I think we already answered that one though. So other than that, I don't have any more.
Okay. Now, let's see, are there any other questions that folks have? I think there's a comment about whether or not the level 2 or 3, you know, addresses the issue. Again, you know, we are doing the best we can with what is available, and it's worth noting that in the hospital settings, most physicians and other healthcare workers are using these in settings that are probably the most likely to have significant amount of these aerosolized you know, conditions. You know, we're again taking advice from professionals on what is best under the circumstances. We all understand their constraints and nothing is perfect, but hopefully if we're able to mask, be vaccinated with the maximum number of doses that are available, and doing so when we're eligible to have them, I think will go a long way to maintain the safety of our community. And we do have a record of having done relatively well because we've been quite diligent, prudent as a community, with a community mindedness to how we've done this. And that is what has sustained us by and large. And I hope that as we continue to do the same thing, that we'll be in a better place than would otherwise be the case. So certainly we all operate in a world outside of our campuses, and that world is you know, full of these same kinds of issues that we've talked about now. And I think Andrew mentioned at the beginning that it's important to recognize that we go back and forth into that world beyond the university and continue to maintain with due diligence our commitment to what we can contribute to make all of us safe. I think it's going to be critical to overall safety, not just of the campus community, but of the communities of which we are a part. So, you know, with that, I'll give the last word to any of my colleagues who has something that we may want to touch on that hasn't come up in the questions. So maybe I'll start with Bill. Is there anything relating to your area that is, you know, worth highlighting that hasn't come up in any of the questions?
Thank you, Wisdom. Just to, you know, thank everyone for the good work and to acknowledge that, yeah, there are uncertainties in coming back, but we've heard from many the desire to have that sense of community that's been partially missing over the last 2 years, has played a role here in our decision making. And you know, So we have a real desire to get back together in a way that's safe, and we've outlined the number of measures that have been put in place to do that. And but we do recognize the concerns that are being expressed.
Thanks, Bill. Desmond, anything concluding?
Yes,
anything you want to highlight?
Yeah, I just wanted to first of all echo as well my thanks to our OSU staff in particular for all they've been doing throughout the pandemic, and because it's been tremendous and very student centric and focused on trying to take an approach of empathy to our students and helping them through these difficult times, and particularly our international students I'd like to mention, because they have been caught up in some very unique circumstances created by this pandemic, and plans of a return and so on that are particularly difficult for many of them. And I know our ISC staff and others, been really working to really try to smooth things out and create alternatives for these students. And it's an appeal also to many of the folks, staff and faculty who are on this call to just keep in mind our international students, because it's a particularly difficult situation for many in terms of their ability to finish their term, to complete courses, and so whatever flexibilities and ways can be found to deal with them, it would be, I think, very, very helpful. But I just want to be very thankful for the work that our folks have been doing throughout this pandemic and in readying themselves for a more fulsome return to campus. Thank you.
Thanks, Desmond. And I know that in addition to also a number of our academic units,
Yes.
So from the Dean's office down to our departments, have been connecting with students and trying to address these issues. And the complexity of operating in different jurisdictions with different restrictions that change by the day in some contexts, gives us a good appreciation of what our students who are not in a jurisdiction that is uniform, like here, are going through. So just an appeal to all of us. And this is, I think, my colleagues in the Dean's office and the related units will attest to the fact that they've been inundated with a lot of questions, and we all feel the sense of anxiety. And we need to just remind ourselves about the compassionate, caring community that we profess to be, that we are, and that we will want to continue to be as we deal with these issues. There are a couple of quick questions. Tamara, if you could ask those just so that those colleagues have a chance to have their questions answered as we get to the end. Go ahead, please, Tamara.
One more. Will there be any flexibility with parking permits for staff that will be working hybrid? So for example, permits are monthly, but perhaps staff are only going in person every other week.
Yeah, and this question has been asked in the past, and I think we'll update something on the website. If you're only coming in every other week, it's actually more cost effective for you to not have a permit and actually just buy daily parking. And so that's where we've tried to create some flexibility for people. It is effectively for the permits to be of value is if you're in the office for more than 3 days a week. Some people are choosing to keep their permits because they'd like to maintain the parking lot that they've got allocated, and that's a choice up to them. But if you're coming in twice a week or 50% of the time, it's probably more effective for you to move to daily parking versus having a monthly permit.
Thanks. Tamara, I'll give a chance for one last question if we have it.
Have any more?
Okay. So, folks, thank you all so very much for making the time, to be here. It's great to hear what is on your minds because it gives, allows us to see where gaps continue to be, even as we all work, feverishly and diligently to make sure that we're taking care of one another. And I know this is a time of tremendous anxiety. We're all dealing with the larger questions pertaining to the institution, the campus as a whole, but we're all in individual spaces and dealing with our own individual challenges as we navigate the world that we're in. So let's continue to be there for one another. Let's continue to be compassionate and understanding. Please reach out as necessary. Don't go it alone. I think that there's, even in this space, the importance of community is critical to our collective well-being. So feel free to reach out. If you've got questions, no question is out of reach. Please ask them. It allows somebody to either tune into the fact that there is a missing part to what we're doing, or to make sure that we have the support necessary to help one another. So thank you for all you do. We will keep you posted as we progress, but at this point, I hope that this provides you with a good understanding of the way forward. And I wish you all the very best. Thank you. Thank you so much.